staggering 4 billion ringgit price tag just to staff Malaysia's health system. That's the estimated cost of adding over 51,000 new healthcare positions since 2019, according to the Public Service Department, JPA. But here's where it gets controversial. Is this massive investment truly addressing the country's healthcare needs, or is it just a bureaucratic reshuffling? In a detailed presentation to the Health Parliament's Special Select Committee, PSSC, on February 27, JPA revealed that nearly 4 billion ringgit, precisely 3,972,642 ringgit, has been allocated to create 51,354 new roles within the Ministry of Health, MOH, between 2019 and 2024. These roles span 5 major service categories: doctors, dentists, pharmacists, nurses, and assistant medical officers, AMOs, along with other supporting staff. This financial projection includes staffing for newly built healthcare facilities and positions approved under a cabinet memorandum dated January 19, 2022, during Prime Minister Ismail Sabri Yaakob's tenure. The breakdown of costs is eye-opening. Medical officers, 1.3 billion rand for 8,927 roles. Other support roles, 1.2 billion rand for 19,352 positions. Nurses, RM838.4 million for 15,064 positions. Pharmacists, 307.7 million for 2,188 positions. AMOs, 221.6 million for 4,568 positions. Dentists, 176.5 million for 1,255 positions. While nurses accounted for the highest number of new hires, doctors represented the largest financial burden. The average cost per position for medical, dental, and pharmacy officers was 140,628, significantly higher than the 55,654 per nurse and 48,515 per AMO. And this is the part most people miss. 83% of these new roles were created specifically for new healthcare facilities, underscoring the scale of infrastructure expansion. To understand how these costs are calculated, JPA refers to its 2009 BPO guidelines. Financial implications include 1-year salary and fixed allowances, such as housing, entertainment, and public service allowances, based on the midpoint of the P1 salary scale for each job grade. But what's driving this surge in hiring? Norazlin Alias, Senior Deputy Director of JPA's Staffing and Organization Division, explained that in 2020, the MOH added 5,185 positions, reversing earlier cuts to less critical roles. Despite existing policies discouraging expansion, JPA submitted a special proposal to the Prime Minister to meet urgent staffing needs. In 2021, another 4,957 positions were approved without trade-offs, followed by a net increase of 3,265 roles in 2022. The term net here refers to the balance after accounting for both new hires and upgrades or trade-offs. So while the number may seem modest, it reflects a strategic reallocation to meet pressing demands. In 2023, the government began implementing a cabinet decision from 2022 to create 1,500 new positions for doctors, dentists, and pharmacists between 2023 and 2025. Norazlin emphasized that JPA evaluates staffing needs annually, especially for new or upgraded facilities, and doesn't limit its focus to just the 3 main service schemes. Nurses and AMOs are also considered essential. Interestingly, Norazlin noted that MOH has consistently received new positions each year, even when other agencies had to sacrifice hundreds of roles to prioritize critical healthcare staffing. As of February this year, 1,295 new positions were approved, with staffing preparations beginning once facility construction reaches 80% completion. JPA also collaborates closely with the Economy Ministry to forecast staffing needs during the planning stages of new healthcare projects. We always prioritize essential sectors like the MOH, Nurazlan affirmed. However, not all staffing changes reflect new growth. Noor Azman Abdul Rahman, Secretary of MOH's Human Resource Division, clarified that the permanent appointments of over 4,000 contract doctors last year and another 3,000 planned for this year are for existing roles, not newly created ones. These appointments are part of a transition to permanent status, while new hires will come from fresh university graduates entering housemanship. This previously unreleased data was included in the Health PSSC's extensive 455-page report titled Proposal to Form a Health Service Commission, tabled in Parliament on August 27th. Now here's the big question. Is this level of spending sustainable? And is it truly solving the healthcare staffing crisis? Some might argue that reallocating existing roles isn't enough, while others believe the focus should shift to improving working conditions and retention. What do you think? Should Malaysia continue expanding its healthcare workforce at this pace, or is it time to rethink the strategy? Drop your thoughts in the comments. Let's talk!